brings us up to 2002. And I think this quote from Sorensen captures a lot about where therapeutic communities are today. But in the last decade, TCs have modified their approaches to accommodate a variety of specialist populations. Prisoners, women with children, adolescents, homeless persons, and those with co-occurring mental illness requiring psychiatric medication. There's constant change in addiction treatment, and that requires consideration, and it did in Coolmine too. The complete loyalty to one treatment system, I would argue, for all service providers, community, residential, aftercare, recovery, but the complete loyalty to one treatment system, particularly an abstinent-only system, is now challenged. Okay, so what I wanted to share with you now is just the full range of services that are delivered in Ireland's therapeutic community. There's a range of contact and assessment services, outreach into the prisons, into the community. There's a Travellers and New Communities outreach service. We have a homeless in-reach service too, reaching into homeless services in North Inner City Dublin to create pathways for people to access stabilisation and recovery-based services, or should I say abstinence-based services, depending on their need and their want. So we also have a drop-in service in Coolmine House in the city centre, stabilisation day programme, contingency management programme that is a part-time service, runs two days per week for people who tend to be working and people whose primary drug of choice may be cocaine. We have a cannabis mental health programme targeting younger clients with cannabis use. Then we have our primary treatment services, which is our two residentials, the men's rehab on the top, which is Coolmine Lodge, the home and where Coolmine originally started. The women's service, which is a 24-bed inpatient programme for pregnant women, homeless pregnant women, or women with young children up to the age of 5. We have a drug-free day programme in the city centre, and we have community detox and a community alcohol programme in Dublin 15 and in Coolmine House. We have a range of integration and aftercare services and lifelong aftercare services. But what we also are providing is quality checks, safety checks and that. And that's our client participation strategy. So we engage with our clients proactively once a week. A community member has a job that is engaging with all the clients across the Coolmine services to find out how the service they are receiving is for them. That gets fed through to the management team, which subsequently gets fed through to the board, and the client coordinator attends the board. So it is a service user participation strategy. We have a range of multidisciplinary teams that are working with Coolmine. We don't provide all of this in isolation. For example, drug liaison midwifery, refer the pregnant ladies into Ashley House. We have a consultant psychiatrist on site in Ashley House for a weekly clinic as well. More recently, we've started to focus on building recovery capital further for the clients that are engaged in Coolmine, such as our Recovery Through Nature programme, our Sailing project, and Fit for Life and for Work too. There's a lot of complex needs for the clients that we are working with. There's significant psychiatric issues, criminal justice issues. 60% of all of the admissions through to the men's residential service, attributing for about 90 admissions per year directly from the Irish Prison Service. We see our clients who have had 2 to 3 previous treatment episodes. We see a family history of substance misuse. 4 out of 5 of the clients engaged in Coolmine services from a snapshot study in 2014. 4 out of 5 of those clients were coming from families where both, if not one, parent was engaged in problem substance use in the home. Significant child protection issues. They themselves may have experienced significant childhood adverse experiences as a result of being in foster care placements themselves, as a result of being in homes where alcohol and problem substance use featured, and indeed other issues. They too now, many, have become a parent themselves, and they don't have a clear point of reference for their parenting, and they don't have that without the use of substances either. And homelessness strongly features. 75% of all the admissions to Coolmine are from homeless services. Okay, so look, we had a significant period of overdue change, and it was framed by successive strategic plans dating 2002 to 2016. And here we are now today in Coolmine, embarking on our next strategic plan, which I'll close the presentation with. But basically, there was key elements highlighted here. Staffing. We needed to train and support our staff. We needed to provide supervision, their behaviour, and they needed formal management structures in place. We needed to assess the programme effectiveness, which we did. We reduced the length, we focused on outreach, brief interventions, building of aftercare and recovery capital. We needed to meet our clients' needs, which is where we merged and adopted more harm reduction strategies and services such as a stabilisation and detox. We needed to focus on our governance in the organisation as well. Finance, our quality standards, our health and safety agenda, and all of that was a tremendous body of work that is ongoing and still ongoing. Coolmine is accredited to the Royal College of Psychiatry in the UK, and our quality standards are through the CCQI, and that was an important achievement and attainment for Coolmine to do, because it gives us some validity in terms of the residential services. And we entered into strategic collaborations with Anna Liffey Drugs Project to conduct the assessments. So we didn't hold dear the need that we would need to do all the assessments. I've been talking to some of the HSE staff here in Limerick. They referenced the link there, the pathway here in Limerick, where assessments are done by another treatment provider in the community, and that assessment then gets the person onto a waiting list where they can access a residential treatment bed. And we also entered into strategic collaborations around housing as well with Focus Ireland and Peter McVerry Trust. And research. That's probably been one of the most significant, and certainly one of the areas that I and my predecessor Paul Cullen would have drove, is the need to research the outcomes, but also the quality of life and the impact that the services that Coolmine are providing are having.